Welcome back, everybody. We are turning to S-197. We have a small amount of time. Worked with Lunch Council yesterday. Thank you, Leslie, for your help, and think that maybe Jen Scott has been listening to us and our conversations and did a put forward proposal of amendment for your consideration.
This is the clean one that we got off that? No, not clean. Jen Carby, Office of Legislative Counsel. This is S-197 draft 2.2. Still showing markup. There's new markup. This is an act relating to what is currently an act relating to going for primary care. And it starts out with the legislative intent and what has now become purposes. And so it keeps the language from the last draft around intent, invest in primary care, and establish a program of universal primary care with those same provisions. Subsection B, the purposes of this bill are to obtain the information necessary to develop a framework for implementation of universal primary care, to optimize the blueprint for health. Number 3, determine whether the blueprint is an appropriate mechanism through which to provide universal primary care. And 4, explore other approaches to universal primary care and whether they may be more suitable than the blueprint in meeting Vermont's needs. Section different than what we had before.
We should talk about it.
Yeah.
We did a lot of commas before and we turned it into a list.
Okay.
I guess we tried to remove assumptions.
Okay. Cause I remember we did have a comma, you're like going insert something in there. Okay, I'm good, I'm good.
Right, then we have section 2. I don't think we made any changes to the blueprint language since the last draft. Section 3 is titled Blueprint Payments to Practices. Maybe it doesn't need to be, but primary care and report. The changes here, it still has the director of the blueprint in consultation with the Blueprint Executive Committee and the Vermont Steering Committee for Comprehensive Primary Health Care, reporting to this committee and Senate Health and Welfare in January regarding changes to the payment amounts or payment methodologies, taking out reform that was in there but probably shouldn't have been, or both that, and then I think the chair was saying removing some assumptions that would be necessary, not are necessary. Was it Representative Goldman who said? Assumptions. Somebody said it, wasn't sure. That would be necessary to transition the blueprints per person per month payments to primary care practices to include payment for the routine primary care needs of attributed patients covered by participating health plans. The report shall, and then we still have establishing definitions of primary care services, primary care provider. Most of the provisions stay the same as the previous draft. Took out this establishing the target for the amount per person per month spending that should be for primary care services. That goes back to being its own standalone section with the Agency of Human Services doing that. It comes out of this blueprint report. Did keep the analysis of ways to incorporate a primary care spending allocation target into the methodology, because I think that was still relevant. In number 10, description of the ways the blueprint can optimize delivery of services within its current initiatives and the amount that would be required to support that. The editor pointed out that I said per member per month here and everything else is per person per month, so making this consistent. And then adding a new 11 that would have the blueprint recommend a process for moving to the healthcare claims tax established in statute as the mechanism to fund the blueprint as identified in the report submitted to the General Assembly in accordance with Act 51 of 2023, including providing a potential timeline for implementation.
I'll go back and read the 2024 blueprint. They have a big thing in there about possibly moving to.
Actually, a standalone report, an Act 51 report, I think is what it's called in the system.
Oh, that's right. It was in there.
No, report. It was submitted in 2024. Submitted in Act 51 of 2023, but the report then came in January of 2024.
What was Act 51 again?
Act 51 was the DEVA housekeeping bill of
Thank you.
2023.
Yep.
All right, section 4, no changes. That is the baseline per person per month. I guess the only change is to add an S here on definitions. Section 5, this is where I put back in and somewhat modified to incorporate some changes from the earlier Senate version, the primary care spending targets. So this would have the Agency of Human Services, not the Blueprint, establish a target for the amount of per person per month spending on Vermont residents that should be for primary care services and develop a transitional schedule that increases the target over time and have them report by January 1st of 2028 provide the spending targets and transitional schedule, as well as any recommendations for adjustments to the targets that are needed to reflect payer-specific differences such as age and health status. And that would come to this committee, Senate Health and Welfare. And then the structure language was just the way it had previously kind of referred to what would have been enacted in 18 VSA 710. What now becomes section 6 is having the Agency of Human Services, Green Mountain Care Board, and DFR in collaboration with the Office of the Healthcare Advocate evaluate the roles their respective organizations play in healthcare regulation and healthcare reform in this state. And then have them, instead of collectively determining, it directs them to identify where each healthcare regulation and function should most appropriately be located in order to optimize collaboration, information sharing, and efficient operations in furtherance of attaining the Principles for Healthcare Reform Act 48 principles. This strikes out establishing universal primary care. I think that was considered sort of part of the work that was going on and not necessarily what the chair was interested in having them focus on in their report back. Improving access to high quality, affordable healthcare services, accomplishing healthcare transformation and safeguarding hospital sustainability and insurer solvency.
Yeah, I'm not sure I cleaned this up at the language, but what's the difference between a report and a report back?
Report back is sort of jargony. I wouldn't put that in statute. The only time somebody that I would say somebody has to submit an actual written report and in the form of sort of what you would consider a report is if it says shall submit a written report.
Yeah.
So we effectively have them report back, but I wouldn't say report back. Like in this case, they're actually providing specific recommendations. So it leaves the form of that up to them.
Okay, got it. So what line is that?
That is on line 13.
Oh, down there. Okay, got it. Thank
So
you.
by January 15th, 2027, the agency, board, and department shall each provide specific recommendations on the distribution of responsibilities resulting from their efforts pursuant to subsection A of this section, including areas of agreement and disagreement, gaps and overlaps identified, and any legislative changes needed to achieve their preferred organizational structures to this committee, Senate Health and Welfare, and Senate Finance. And again, they must be available to provide updates between now and January. Section 6 came out. There was discussed yesterday that would need an appropriation. So section 7 is the transitioning care to community settings report. And I will also note that they always say report in the section because that's how my office can try to keep track of what reports you are expecting, what report backs you are expecting in whatever form. So that's why I consistently use report, but it doesn't literally mean everything has to be in the same report.
Can I say something about the structure of section 6? I just want to be clear. I mean, the reason we struck this through is we heard concerns from the board that this is very labor intensive to do this. And that it would require financial support. But also, let's not forget in Act 68, as part of reference-based pricing, we kind of have them also looking at or setting floors for the community base. So if you remember in Act 68, they have a ceiling on hospital-based services, and then they are able to develop floors or community-based. So they're already in reference-based pricing, kind of looking at the concept of neutral reimbursements. And since it's needed an appropriation and, it's not like they're not thinking about this in the context of other work that they're carrying out, that perhaps it'd be best to strike it. That was my reasoning for striking it. Thank you. I just wanted to put that on the record.
Again,
But I don't think it's not important.
editors noted in looking through this that we usually refer to it as the statewide healthcare delivery strategic plan, suggested adding back in statewide, which I thought made sense, so I added that. Universal primary care efforts in other states. This section has also come out, as I believe you had no takers for doing that work.
Everyone wants to pay.
Section 8 is now renumbered, but otherwise the same, having the Office of the State Treasurer work with other northeastern states to look at a regional and universal primary care program. Section 10 is language that is included in the budget, and I've confirmed that it seems to be in the budget with no indications it's coming out. This was removing the sunset on the scholarship program for medical students. It was otherwise scheduled to be repealed on July 1st of next year. And this committee had proposed in your budget memo to remove that sunset. That suggestion was taken up by the Health Appropriations Committee. It was also included in the Senate Appropriations Committee version. So that appears to be moving in the budget. Section 9, and if somehow it doesn't, you're back here before it gets actually.
Actually, this isn't really for you, but did the treasurer, and maybe we can speak about this? I missed
The
it.
treasurer testified like one of the first days and they said, yeah, they're fine with that. They've done this before.
Okay.
What is now the renumbered section 9 is the health insurance provision that requires a health insurer to notify individuals covered under a health insurance plan who have recently taken a medication, give them at least 60 days notice before removing it from their formulary. So coverage will end. And then we now have section 10 is the effective date. And we had talked yesterday about perhaps an act relating to reform for primary care. That is what is in here related for your review.
Go ahead, Karen.
I just had two questions, Jen. Because 6 is eliminated, would section 7 become renumbered section 6 and so forth?
No, because I've already renumbered the newly re-added back section 5 to be section 6.
Okay,
So I've already renumbered.
okay, thank you. I expected you had, but I,
And the editor's check too, but yeah.
and then, the. On page 10, I guess line 9. The language is somewhat changed. It just says improving access to high quality affordable healthcare services. It seems much broader than the primary care does.
So that language was in there. This is just taking out the establishing universal primary care, and I'll let the chair speak to her interest. This is on page 10. This is the distribution of duties between the Green Mountain Care Board, Agency of Human Services, and Department of Financial Regulations.
Yeah, this is, so if you remember, I think it was Director Olson sort of indicated that, possibly she would like the focus to be a little bit not quite as prescribed, because then they would start going, I'm paraphrasing, but they could spend time going down rabbit holes to try to do these prescribed things. And as I explained kind of yesterday, the rationale for this is, if we're going to move ahead with reference-based pricing, I'm not asking these agencies to get together to figure out who should be doing that. I'm trying to get these agencies to look at our existing structures and how they're working together, sometimes at odds. And again, when I say at odds, I don't mean like anything intentional, just that some of their divisions of duties kind of conflict with each other. And so if we were going to remove anything, I didn't want to put establishing universal primary care, because then they would all get in a room together and decide who should establish universal primary care. And I don't want them to do that. I want them to look at themselves now, so that we, the legislature, or whoever's sitting in these seats moving forward, can make better decisions around when we do move forward with universal primary care, who is best positioned and function, and how can we make sure that the various agencies that we have within state government can achieve that to the best of their abilities. So that's why I removed the universal primary care. I really don't want them fighting for that.
It's bigger than that. I mean, that's sort of the idea. Way bigger.
I want them to look at themselves now,
Whole system.
the whole system now. I think.
What is the healthcare claims tax?
Oh, no.
It's 233.
There is an
There's an
existing.
existing healthcare tax. So there's an existing tax that is imposed on all healthcare claims for services delivered to Vermonters. So this would be looking at whether that would be, or how, I think Blueprint has already identified that might be an easier way to get payment to support the Blueprint that would be more broadly distributed across all Vermonters who are receiving healthcare services in the
Is
state.
that a flat rate tax or how is
Yeah,
that?
yeah.
I don't need to open up.
I think it's
things.
1% right now.
1%.
0.999%.
Why? Why?
The insurance company pays that charge.
And it's all claims. Yeah.
All claims except Medicare and Medicaid do not pay.
Who decided it
All
was
commercial claims,
99?
all commercial.
So pharmacy benefit managers are on the
Yes.
list of who pays?
Everyone pays except for Medicare and Medicaid. There is a
Well, that's an interesting
report,
point.
this Act 51 report. Well, you know what we could have? I'm sure he would love this. In the next week, if we have time, we could have Nolan come in and talk about claims.
It's probably.
One of his, what did he say is his number 7 favorite subject?
Nice.
He said that.
If there's something written on it, I mean, if I'm gonna report this baby, I better be able to speak to it. If I'm gonna report this, I better be able
Most of it
to
goes
speak to
into
it.
the, I'll let Nolan do it,
Yeah.
but most of it goes into the general fund, and then there's a very tiny portion of it that goes into what's called the HIT, the Health Information Technology Fund, and that's what actually funds like vital.
There's the claims, there's the chapter
There we go.
on the claims tax. So it is imposed on every health insurer, and it's a very broad definition of health insurer and health insurance. There is imposed on every health insurer an annual tax in an amount equal to 0.999 of 1% of all health insurance claims paid by the insurer for its Vermont members in the previous fiscal year. It's paid in one installment due January 1st. 0.199 of 1% goes into the HIT fund, and 0.8 goes into the general fund. This 0.199 part comes up every few years for review because it has a prospective repeal on it. Thinking this is budget or miscellaneous tax, it would take it out 5 years, so we don't have to have that conversation again for a little longer. So it goes for certain things like the annual cost to obtain information from the All Payer Claims Database, our VCures system for use by the Department of Taxes comes from the HIT fund and the general fund in the same proportion as revenues are deposited into those funds. It expresses the legislative intent that all insurers contribute equitably if it was found not to be enforceable as applied to third-party administrators or other entities. Tax owed by all other health insurers would remain at existing levels, and the General Assembly would have to figure out another funding mechanism that would be enforceable as to all health insurers. So you can see it defaults based on that sunset of the 0.199% sunsets, and we would just have 0.8% if that ever goes into effect. But that's been happening for a number of years. administration, the Commissioner of Taxes administers, so some of the details that will have to be worked out in the reporting request in the bill would be to figure out how to get money between tax and Blueprint, for
Do
example.
we know how much that raised?
Yes, this is Nolan, these are Nolan questions.
questions.
Nolan has an issue brief that he updates on the JFO webpage, and I can work with him to
I
get.
can't believe I'm saying this, but I look forward to it.
Yeah.
I went to the JFO website. Can we find it?
If you go, well, if you go to the reports, it's just called the Act 51 report. Could you send that to all committee members and they'll also post it on
But
our?
that's not Nolan's.
No, that's not Nolan's
All
priority,
right.
but this is the consideration of using the claims tax as an alternative to how Blueprint is funded now. That's what that report was.
Just to clarify, with the claims tax, and this is one of my issues with this whole thing, the claims tax encompasses everybody, that's Alyssa, everybody. So it makes it much more equitable that everybody is paying into
Here's
this plan as opposed to just the
So Blueprint
market price.
currently the only insurance that that pay into the Blueprint are the plans that are regulated.
Yep.
And also Medicaid. Medicare is no longer because of the ACO paying into Blueprint. And yet all the services that are provided by the Blueprint are actually offered to the entire population. So we have a smaller and smaller payers that are actually paying for the services that are provided by the Blueprint. So there is a report with recommendations about how to more equitably fund the Blueprint so that everyone is paying into it.
All right,
Yeah.
thank you.
So I'm just asking them to look at it
Yep.
again. Yes. So
I was trying to raise it, but I don't want to be like, ooh, ooh, ooh. So I'm going like, oh, never mind, like, never mind, like, never mind. And then it's like, okay, now is, so that being done,
You forgot.
I just want.
no, it's right on the tip of me tongue.
We're in a time.
It's on the
crunch.
tip of me tongue.
So
Can we somehow squeeze into this bill, finding out how much the claims tax would have to be to fund universal primary care by chance? Like is there somewhere in here where we could ask some group studying something?
We'll find out.
How much would this have to go up to, not only to fund the Blueprint, but also to fund all of, because that might be a real easy way to do it.
We do have AHS in this bill, sort of figuring out what's kind of the optimum per member spend target for primary care
Yeah.
would be, and considering that they would be calculating that number, and the claims tax is a very known quantity. I'm sure that calculation could be done very easily, and I don't think we need to direct it into the bill for the sake of time.
I actually see that point.
Okay.
If we get the number from the Blueprint and we know the claims tax, we can have JFO tell us that next year. But I'm just thinking the claims tax might be the most equitable way to fund universal primary care because it's not an income tax. It's not a new tax. It's using an existing tax creatively.
When we do our summer research.
We can talk about it more. All right.
Because we're gonna talk about all sorts of ideas for
Okay.
methodologies.
Okay.
But we
Wait, I'll let it go for now.
Yeah. Okay.
I did text Nolan. He's on his way if people have questions for him.
Usually we involve Nolan and like 3 minutes later, he'll come walking into the room.
Here's the issue brief on the healthcare claims.
So I'd like to, okay, any other questions about the language? I am sorry, I feel like I'm rushing people and I don't, but, a few of us needed to be somewhere a bit ago.
Okay.
So, and we got an exemption to be in this committee room. Any thoughts, any comments, any questions?
It was 2 minutes this time.
Yeah, only got one.
He looks so happy right now.
I said maybe next week sometime when we have time, you can talk all about your seventh favorite subject, the claims tax. But
No, it's not my age.
Is it?
No.
I sent, Martha, your updated issue brief, the post
Jen sent a smoke signal, I can run.
I apologize. I asked what the healthcare claims tax was.
That's the right question.
I apologize. Good question.
And then he asked how much it raised, and I said, that is definitely an all question.
All right. Any other thoughts on the language? Anyone want to express disdain or I don't know. I guess I'm looking for.
I think disdain's over for the day.
Okay.
Yeah.
Oh.
No,
Okay,
I
so
think
I
it's
asked-
good. I think it's worth looking at. Yeah. I like it.
I asked, yeah, Ethan Park,
Yes.
are you about there? I'm not sure. Okay, what he thought, and he thinks it's good.
Yeah.
So I felt good about hearing that from him.
And I will
Wait,
say,
what's
I'm notorious for email communications, but for anybody watching, I have heard and seen all your emails encouraging us, and I really thank you for those. I don't know if I'm just getting them or if you're all getting them, but
No, I'm getting them
Yeah.
thousands of emails at this point. Thousands.
I appreciate it. And I appreciate everybody that came to our public hearing.
Mhm.
That was wonderful. I appreciate everybody in the committee and you're really robust and great conversations around primary care we had this year. I wish that we could serve in this legislature all year round and we could do, because we can do hard things and I wish that we just did not run out of time, but I appreciate that we got exactly where we got to. At least. I would make a motion, wait, is this a straw poll?
No.
No, this is a.
You need to,
Is Lori not gonna vote?
we need a real vote.
Yeah.
You wanna give her a
we
chance?
do. She's not able to
Okay.
make it. I make a motion?
Yeah, I got a question first.
Oh, yes,
No money and just a study.
not a dime.
Wait, studies cost money.
No,
On this.
every
page.
person.
Nothing
in
to
here
vote.
said reports. See, they're, no, they're
Not appropriate at this time.
not reports, they're, as Jill said, send a letter, or if they want to do like interpretive dance to tell us what they did.
I want a puppet show.
I would like shadow puppets too.
The only money is really, like.
Exactly, though there is a cost, that's what I'm trying to say.
But that's it.
And this is to help identify.
Later.
what that
There's
number
no
is.
additional
But
cost.
they would-
Oh, my God.
Yes, but
If we know what that means. We believe it's the job. I think that's the question. Do we believe that we should direct people to do this, who are working at this? To do this? So I think that's the
I will
nature.
remind, I mean, it says report back, but these are people who are actually already working on these things currently.
Yes.
So, but you can't. Would you like to make a motion?
I would like to make a motion that we vote to approve S-197 draft number 2.2
second.
as amended.
Just strike off.
Oh,
Okay.
Shame the straight off.
We're to vote.
We're in the middle of.
I'm reminding members, we're in a roll call.
Oh, wait till fast. Who needs these anyways? Brian Chena,
Yes, with explanation. I'm just. Yes.
Wendy Critchlow.
Yes.
Alan Demar.
Yes.
Leslie Bowman.
Yes.
Lori Hogan. Karen Leaders.
Yes.
Deborah Powers, yes. David Susie.
Yes.
Valerie Taylor. Daisy Brubeck.
yes.
Elsa Buck.
Yes.
So it's 10. No,
Yes, from Lori, but I don't know
I
if she
know.
wants to.
She has to be here in person.
Okay.
Maybe that was on the straw poll from an hour.
She was thinking it was a straw poll. She had texted me and said. No, she's upset. Yes.
So
Yes,
it's 10-01.
10-01.
And it's
I-
favorable with amendment?
Yes,
And I would love for Leslie. to-
favorable with amendment.
Oh, sorry.
You don't
All
All right. So the reporter will be Leslie. Okay.
Okay.
Thank you, everybody. We need to meet. I just spoiler alert, we gotta meet on, let's say 9:30 on Tuesday before floor. We have to hear, because I believe 577 was just amended slightly.
It is, I can read it
Yes,
right now, we can vote on
We're
it.
at 9:30, but you can.
Yeah,
Can we do that, or I can tell you now, or?
Let's just, it's one paragraph.
It is, yeah, but it's extremely minor, actually. I didn't
Take a straw poll on this.
create didn't.
Remind me what they are at.
Yeah, I will.
Array RX, it's a date change and it goes from card to discount.
It's
junk
not,
card.
it's not, so I will walk through it.
Okay, thank you.
All right, let's make sure this is the right one. All right, so this is 577, an act relating to establishing the Vermont Prescription Drug Discount Card Program. They made two instances of amendment. One is purely technical. The other one is what I've highlighted here. It's not, I didn't do a markup for you because I didn't show you the whole thing. But in the section that you've set, where you've set up the program, you had the report requirement. They kept the report requirement, same date. But they added, at the recommendation of the Office of Healthcare Advocate, that it also report on the impact, if any, of the program on the viability of Vermont's pharmacies. As you may recall, there was some discussion of that in here, more across the hall, more downstairs. Seems like some of the concerns maybe have been ameliorated, but this would, but maybe not all. So this would have that as part of the report. And then in a later section on the special fund, if you remember, they repurposed a special fund and made it bigger to fit this in. I forgot to put the word card in one of the instances of drug discount card program. So it just said prescription drug discount program. And so we're inserting card.
Mhm.
That's it. That's technical.
Right, unless anyone has any questions, we can straw poll this now, and we won't have to come in Tuesday morning.
I want everyone to come in.
All those in favor of concurring with the Senate proposal of amendments, please raise your hand. 2, 3, okay, I'm just gonna go with 10 because
I bet Lori said yes.
I will ask.
Okay.
So that's a straw poll, and you were the reporter of this, Wendy? Okay. So, we'll ask Lori and then, we can make it 11:00.
So this is actually because we have a token session on notice Monday, which means I have to report Tuesday.
Yes,
Yes, unless, does it go anywhere?
it's on, no.
It's already on the calendar.
Oh, wait,
Only the report of the bill has to show up Monday.
I don't think it has to be on Ways and
I'm
Means.
just picking on Wendy.
Oh,
Thank you for reminding us. Do we have to?
I just have to remember where it went in the,
It went to both Ways and Means and,
no, it went to just appropriations.
I know it went to Ways and Means because that was where the.
Finance? It didn't go to.
No.
Oh, 190. I'm talking about 197.
Oh,
190, yeah, 190 is still across the hall.
yes, no, I'm talking about 577.
Oh, were you talking about 197?
Yeah,
It was, you
I'm
guys
trying to
started-
remember.
As I got
I would go
197.
home, like.
I
after
did
the
go over there.
festival,
No, I'm sorry, I backed up a little bit because we didn't talk about when it was actually
When-
gonna be on the calendar and when I had to be.
197.
197 went to appropriations in the Senate, but I don't,
I have plans.
it didn't go to finance. I'm looking at the history. I don't remember why it went to,
Still had the, had,
the study was in the other one.
Okay, well, there's a chance it might go to, there's no fiscal note.
And we're not really remembering why it went.
577 when I thought.
It might affect.
There was language in there that would have allowed, that would, Ways and Means initially, but there were language that would allow the treasurer to be.
Yes.
I think it might have gone to appropriations in the Senate because as constructed, there was the suggestion that in the future, there would be payments going to all-inclusive payments that might have an impact on Medicaid, I think is sort of, and or the,
I wasn't even in there when they tested.
All right, oh, so, okay, so one.
so I don't know if it will, it'll depend. So it may or may not, 197 may go straight to the floor or it may go.
So be prepared for Tuesday, because it was
Okay.
ordinarily, yeah, no, it's Tuesday and report Wednesday, but.
Yes, right, with token session, you
Token
lose a prep day.
That's our first token session.
And Wendy, so it doesn't need to it doesn't need to go back to Ways and Means.
No, it's actually not even officially in your committee. It's just on the calendar.
Oh, yeah.
It's just gonna be on the calendar.
Okay.
Oh.
To straw poll it,
Um,
we just concurred.
They can do what we did.
I'll let them know.
Well, let's straw poll it, because you have to point it.
No, right. The question is, does Ways and Means need to straw poll it? Does
Oh, they-
appropriations need to straw poll it?
I'm having.
I don't- I don't know that it usually goes to all those,
I will ask the,
but you could certainly answer. You can ask the clerk's office, yeah, or the clerk.
okay. Thank you, everybody.
Yeah, so your question.
Wait, is this on record?
Yeah, 33 million. Claims assessment rate is 33 million, 26 of which goes to general fund and the rest goes to the HA.
Oh, so I should know that, right? Yeah.
You should look at Nolan's.
I have it.
Yes.
Are those numbers in there?
Okay.
Are the numbers in
Did it
there?
in January.
All right,
Okay,
okay.
perfect.
Just the date.
We can go.
Good luck. I will not be here on Tuesday.
You will not be here.
I will not be here on